we need to educate them. One of my favorite PPP questions is, educate a nurse on how to position their stroke patient. Okay, so if this is the affected side, what is one of the most important things? That their head are not like this, okay, all right? That you can rather bring the bed up. If people feel, I'm one of those people, I can't have my head too low, I need to see, and that's important for them, especially in terms of, because if you lay like this, you don't see your own body, and we want to encourage that. So rather bring the bed up than to put them on too many pillows. Isn't that better already?
Yes.
Now they can scan their environment, they can see their bedside table, etc., etc. So one of the most important things with stroke patients is that the shoulder is forward. Okay? All right? And then, of course, you want, so you can put a pillow there, and depending on their arms, I sometimes use more than one pillow. And a nice technique is to kind of tuck that in. Don't ever do that. So, right there. If the person already has developed some tone, a quick thing that I sometimes do is I put a towel on there.
In between the fingers.
And I just pull this through like this. Look.
Finger spreader.
Okay? So is that comfortable? And then you also want to make sure that their legs doesn't turn in, all right? So you want to sometimes put the leg on a pillow, all right? And prop it up a little like this so that it kind of stays externally rotated. And with nursing home clients, you might want to make sure the heel is free. All right? Before we go back away from this, where would I put her bedside table?
On the right.
On the
Our right. It's our left. Right.
Look, watch the Jen Davis video. I'm not pulling, I wouldn't do this with the patient, but see, it makes her aware of this, and she's kind of moving over this. Okay? Where would I put the call bell? The call bell.
On the left side.
On the right side. We don't want to mess with that. The call bell.
She's not deaf.
Okay.
She had a hip replacement.
That I would put on that side. But other things like her remote, other things I might put here, so that it aware. Where would I talk to the patient from? Right here. Raise the bed. Do this while I talk to her. Make her aware of this arm. Where is it? Can you touch it? Can you get hold of it? Okay? Encourage the family. This person might keep looking on that side. Keep looking there. Can you look at me? Can you turn your head over this way? Very good. And the next moment she's back there. Okay? So when I leave the patient and I want to position them, these towels are a little small, but I can always do a little roll and then put some, can you lift your head? Some of the towel under there and then the roll there. That kind of cues them that the head wouldn't go that way. Okay?
I'm shaking.
All right. Now, how else can I position her? Side lying. Either on that side or on the good side. People usually don't, I mean on the affected side. That gives proprioceptive input. And again, if she was laying on this side and her bedside table is here, it's going to even improve that weight bearing and movement over that joint. All right? So how do I do this? The important thing is, with stroke patients, or with any patient, you want to make them do as much as you can. So I can easily take the draw sheet and come this way and say, okay, let's bring you over this way, all right? Or I can ask the person to be active in the process. So scoot over. So how do I do that?
See, like,
Okay.
if your back goes in.
So what we're going to do first is, can you grab your hand, use that hand to grab that hand, very good, bring it up on your chest. Now see if you can put your hands together like this for me. Okay, very good. So let's try and raise that arm up here. Okay, how does that feel? Can you hold it there? Any pain? Okay, let's bring it down, hold the hands together. Can you bring this leg up? Bend it. Very good. How about this one? Can you help me? Okay, that's good. Keep going, keep going. All right. Why am I doing this? Prepare to do what? Well, that is how I'm going to roll. But what if I'm now going to roll on the affected side, what is going to happen? Let's roll. Now, bring your hand up here. Now look here. I can roll her with my pinkies. Okay? Seriously. Okay. No, it's not that. Okay, but look at it. We're at the edge of the bed. That's not going to work. So I will first have to go that way before I can roll. Correct?
Yeah.
Okay. So how do I go that way? I want to make sure that she helps me. Okay. So let's see if you can bring your hips up and then scoot them that way. Now, you can, various people do various things. Some people will now go to the other side of the bed, okay, to help the person scoot that way for their own body mechanics. I can obviously bring the bed up, but let's see if you can scoot the bed this way. Now bring that leg over. Now let's see if you can help me with this leg. Okay, let's do one more round. There we go, bring up, there we go. So you get the idea. So scoot as much as possible to that side, okay? Now bring your hand up. Now let's roll towards me. Okay, there you go. I walk around, hand petrals up, petrals up. Okay, so now she is laying on the affected side. Okay, I am definitely going to, do I want that leg straight or bent, the affected leg? What is the tone pattern of the lower extremity? Extension or flexion? That should come off like that. The tone pattern of lower extremity is extension, right? Like this. So do I want that leg bent or straight? Bent. Because I want to break up the pattern. So she can either lay with two legs together like this with a pillow, or she can make that leg straight and that leg bent. That way also she stabilizes herself in that position. Right? Okay. So what do I do with this arm?
Retract the shoulder.
You want to make sure that when she rolls, and that's what that roll is great for, because they will be rolling over their scapula, and you want to make sure the scapula is forward. Let's roll that side so they can see. Okay, so let's say this is the affected side. Can you scoot back? Then this leg has a pillow and it can be less. Does that feel comfortable? Okay. And I want to make sure that when she rolls, that shoulder is forward. That she's not laying on it like this. That would be terrible. Okay. So, she could have even, you can now see, she could have even scooted far more. Because some of her hand is now laying off the table or the bed. Do you want it like this or like this? Externally rotate it. Alright? Now you can either make it straight if there's space with a pillow there, or it's okay for me if they have it like this. Because it is in a tone inhibiting position. Okay? And then you can, sometimes it's important to put the pillow back here. Alright? And then I can also put a pillow here. Is that comfortable? Okay. And then of course I can also position them on the good side. So you need to know that. You need to know how am I setting this person up. Okay? So let's go back to your back. Lay on your back.
Let's go back to the beach.
Alright. So if I'm going to get this person up, I can think two ways. I can think either I want to use that affected side therapeutically. That's why therefore I want to transfer over it. I want to use it during the transfer. Or because it's the first time I'm working with this person, I'm not going to take a chance. I'm going to use the strong leg to transfer over. Usually when we start using that leg therapeutically, we want them to take weight on the leg. That we usually do in outpatient. Okay? Alright, so we're going to get up. How are we going to get up? Again, I'm going to use my same rolling technique. Alright? Again, I need to think if I'm going to roll, is she going to roll off the bed now? So I might have to do the scooting thing that way. See, this is all clinical reasoning and planning. So let's just scoot that way. Okay. So let's say she's weak on this side. Alright. Can you remember what we do when we get up? Bend that leg. Okay, now let's try this one. Can you get your hands ready? Alright. And reach up. And now you bring your hands over this way and see if you can roll. Come on, come on. Very good. Excellent. Very good. Alright. Now what we're going to do is we're going to use this hand to help us push up while we going to put the legs over the edge of the bed. And the way you can do that is by walking your foot there. Alright? Can you move it towards the edge of the bed? Very good. Right there. Now we're going to push off, and I can help you a little. Bring this down. And there we go. Okay? The moment I'm here, I'm going to put this hand here. I'm going to put this hand here. Lift it nice and tall. And then I'm going to bring this down. Okay, it is. Okay, so that's as low as it is. Now what we want to do is we want to scoot forward. So let's walk on our cheeks forward. Okay, first this, okay, that side. Now this person might be way too weak not to even bring this, then I can help them. Okay, keep nice and flat on the back. Okay, sit nice and tall. I might be sitting here. Now if I have, can I have the bedside table? Please. And remember when you remind me to look up that thing. Nice and tall. Okay, bedside table this way. Alright. And bring that other hand here. Now what can we do here? Tons of things. She can start washing her face. She can brush her teeth. She can comb her hair. She can eat breakfast. We can start feeding. Okay? Why am I having the arm here? Weight bearing, sight, she sees it. She's going to take weight over it. Alright? a lot of good things. He's working on the posture.